You are joining the meeting.
Hi, everybody. Welcome to today's webinar. Before we get started, we just have a chat question for all of you. And if you'd like to type your answer into the chat box there, it says, what is your favorite thing about working at your college or university? We'd be very interested. And the webinar will start in a few minutes. Thanks. Hi, everyone. Welcome to the webinar. We're going to begin in a few minutes, but before we get started, if everyone wants to type an answer into the chat box, you can just type your answer right here in the little space which is to the left of the green arrow that I'm hovering, and hit return, and it'll show up. We just sort of would like everybody to put in what your favorite thing is about working at your college and university. I see Rachel McNamara said the people are always friendly and it's almost always warm there, so I assume you're Southern. The opportunity to be consistently exposed to new information. And Rachel likes your comment, CJ. And the campus climate opportunity to serve are most in need. Great students, wonderful location, pretty area in the mountains of North Carolina. From Denise, and Sharon says a strong sense of community and caring for students. So just keep them coming. We'll start in a few minutes. Thanks. Hi, everyone. Welcome to the webinar. We're going to start in just about 1 minute now. Thanks for everyone who's typing into the chat box. I see a lot of people have put down that one of their favorite things about working at a university is the great students, the diversity of the student body, the fact that it's very pretty, faculty and staff. I see the diversity of the workplace, a strong sense of community. So this is really nice. Just going to scroll back up so people who are just joining now can see the question. And it's, what is your favorite thing about working at your college or university? So we're going to start in about 30 seconds, but if you want to type in, feel free. We'll start in pretty soon. All right, I think we'll go ahead and get started. Thanks everyone for sharing a little bit about what you like best about working at your campus. And welcome to today's webinar on strategic planning for your grant staff and beyond, for your grant and beyond, pardon me. This is the second and final SPRC webinar in our training series for new campus grantees. And we are recording the webinar, and we'll post it on our website in a few days, so no need for you to frantically take notes. You will have access to the presentation later. We'll also be monitoring questions throughout, so the chat box that you used just now to share a little bit about what you like about working on your campus is also a place where you can put any questions or thoughts that you have, and we'll try to take those as we go, and we'll also pause at a couple of points for discussion. My name is Ellie Stout, and I'm the Prevention Support Program Manager here at SPRC. And today I'll be co-presenting with Sheila Krishnan, who's one of our campus prevention specialists. And I'm also joined by Zoe Baptista, whose voice you just heard as you were joining the webinar. She is our project coordinator and tech extraordinaire. And I'm going to actually hand it over to her for the next slide for some information about the technology we're using today. Hi, everybody. Just very quickly, in terms of technical issues, if you're having any problems, please call us, SPRC at 617-618-2984, or you can call Adobe Connect directly at 1-800-422-3623. As Ellie said, if you have any questions at any point during the webinar, please type them into the chat box, which I showed earlier. You can type in right here to the left of the green arrow. And just hit return, and your question will appear in the chat box, and we will attempt to assist you if you have technical problems or content questions. And then finally, if you'd like to make your screen larger, the presentation screen larger at any point, I'm sorry, the green arrow isn't sticking on me, so I'm going to get rid of that. But there is a full screen button in the upper right-hand corner of the slide, and if you click on that, the slide will get larger so you can see it more clearly, and if you click on it again, it will reduce back to the size that you see it now. That's it. Thanks. Ellie? Thanks, Zoe. Okay, so before we get started, some of you may have thought in your head this question when you saw what the topic for today's webinar was. After all, you've already done your proposal, you have your objectives, so the planning piece seems pretty taken care of, and you're just getting your grant started, so sustainability after the grant probably feels a long way off, and of course that's true. But there are a few reasons why it makes sense to think about our topics for today at this point in your grant, so I wanted to just share with you a bit of our rationale. First, you wrote your grant a while ago, and maybe you weren't even the person who wrote the grant. And this year's grants had a pretty quick turnaround time, as I recall, maybe just a few weeks. So you're probably in a rush as you wrote it. So now is a great chance to remember the longer-term changes you were hoping to create on your campus with those objectives that you put in your proposal, and to maybe tailor and clarify the specifics of your strategies and activities and how they connect to those longer-term goals. Second, even if you had all the strategy and details in your head when you wrote the proposal and you still remember them crystal clear, chances are you have some new staff on board. Maybe you hired a new project director or coordinator. You have graduate assistants that are joining your staff.
Maybe you even have an evaluator who's joined your team. And so clarifying your objectives and goals can be really helpful to get that team on the same page and give everyone that same long-term vision that everyone's working toward. Having clear objectives and a sense of what you want to change can also help in planning your evaluation so that you know how you're going to measure success before you even get started. And then finally, in terms of sustainability, many of the grantees who've come before you have told us time and time again how they built their program in the first place made the biggest difference in how they were able to continue suicide prevention work after the grant ended. So thinking from the beginning how what you're building will last beyond the grant is a good mindset to have. And so we'll talk a bit about how to build that mindset even at the very start. I want to emphasize that today's session is not meant to encourage you to change your actual grant objectives that were signed off by SAMHSA when they funded you. That's usually reserved for very exceptional cases, and you would need to talk with your SAMHSA government project officer to do that. So here we're really trying to clarify some of your thinking so that you're really set for an effective program that will last for a long time. And throughout the webinar today, we're going to be sharing some words of wisdom from former Garrett Lee Smith grantees. And as you can see here in the top quote, one thing we hear a lot from what we call alumni grantees is that it's essential to start slowly and allow yourself plenty of time to plan your strategies. We all know that real change on campus can take a long time, and it can be hard to create successful programs that will last without taking the time early on to think through exactly what programs and strategies will help you achieve your goals and objectives. Many alumni grantees also have pointed out that it can be hard to get everything right the first time. So it's essential to keep a close eye on how your program is doing in terms of meeting your objectives and to leave room to make adjustments along the way if what you originally planned isn't working as expected. And I can tell you some things will work out as expected, but definitely some things won't go as planned. So that flexibility while keeping your strategic mindset is really key. So today we'll be walking you through the first few steps of this strategic planning process. And that's something that we offer to you as a framework to help you ensure your suicide prevention efforts are as effective for your unique campus community as possible. And many of you may already be familiar with some of the concepts in the model. There are many strategic planning models out there, and most of them have the same core components. And if you have done strategic planning in the past, we do hope you'll speak up in some of the discussion questions we'll be asking so that the rest of the group can benefit from your experience. But if you're new to these ideas, please don't hesitate to ask for clarifications or questions. You know, there are no stupid questions, and this is something that might be new for you, so please don't hesitate to speak up. One thing before we get into this I wanted to emphasize is that this is not necessarily a linear process. So you might get to step 4 and then realize, oh, oops, I need to go back to step 2 and rethink my long-term goals. So even though this is a very linear presentation with the arrows one way, chances are you might bounce around a bit. And so our idea today is to really help you develop a way of thinking about your work that keeps you asking questions about why you're doing what you're doing and how you can make sure your program is as effective as possible based on what you know. So we'll start with step 1, which is describing the problem and its context. And I thought I'd ask all of you, particularly those of you who've done strategic planning before, why would you say it's important to start with a problem analysis? And you can type your thoughts into the chat box. You know, we know suicide is a problem, so why would we want to describe that problem in more detail? What are the benefits of starting there? To provide context, great. see if other folks have ideas. Absolutely, looking at unique issues for your campus. Very good. A few other ideas coming in. To know what the problem is on our campus and identify strategies. Oh, absolutely. Baseline is also really great to know sort of where you're starting from before you identify what changes you want to implement. Great. Well, here are some ideas that we had in terms of why starting here. I think for some of you this may seem really intuitive, but a lot of us sort of jump right into activities. Maybe there's pressure from senior administration to just sort of do something, or some people hear about what another campus has done and just figure, oh, that will probably work for our campus too. But as people mentioned in the chat, it's really important to look at what suicidal behavior and suicidal thinking looks like on your own unique campus. What are the circumstances surrounding deaths and attempts if they've occurred? Who is most at risk for suicidal thoughts? And what is the context, as someone mentioned? What's currently in place? What gaps exist? What do people perceive the needs to be on campus? And I'm sure all of you did a lot of this thinking in your proposal, but you may want to kind of come back to that information and make sure you have a very clear picture of the unique situation and needs on your campus. And that's going to help you narrow your focus and make sure you're not duplicating things that already exist. And this involves not only accessing sort of quantitative data, if it's available on your campus, but also talking with various campus stakeholders to get a sense of the situation on the ground and what their perceived priorities are. And that can also be a great way to get their buy-in and sort of come to the same page with them on what the priorities are so that you have the support of the community moving forward. So we're going to move to a poll question, and so it's going to pull up an interactive version of this. And we'd like to hear from you what sources of information you used when you were writing your grant to determine what suicidal behavior looks like on your campus and what priority areas you wanted to focus on. And I see people are already clicking, so go ahead and select as many of these as you used. And nobody's clicked other yet, but if you did click other, if you could just type a few words in the chat to let us know what other sources of information you use, that would be really great for that one person that clicked it. So it looks like almost everyone used national surveys. A lot of people also use state-level data, and it's great to see that many of you had campus-specific surveys available to you. That's really wonderful, and a few folks using focus groups as well. All right. Well, thank you for sharing that, and it's really wonderful that so many of you were able to find some campus-specific information to better understand suicide on your own particular campus. I also want to acknowledge, though, that getting data that is particular to your campus can be challenging, and so if you feel like you need more information to better understand the problem, these are just some ideas of how you could collect any data that might be missing. And since a lot of you did get information that was specific to your campus, I don't want to emphasize this because you already obviously know, but there are a lot of advantages to supplementing the national data that may be available to you. So we know of many instances where the national data might point to specific groups that might be at higher risk. For instance, maybe at the national level, student veterans are at higher risk for suicidal ideation, but you might find on your campus that there are other populations that are higher risk, and so you want to just kind of verify that who you're targeting and what you're focusing on really is responding to the need on your campus. So that's sort of my very quick overview of describing the problem. I wanted to pause here before I move to the next step to see if there were any additional pieces that people wanted to add, if they've done this step in the past, or any questions that people have. Okay, I don't see anyone typing, so steps 1 and 2 kind of dovetail nicely together. So once you've gotten that clearer sense of what the problem of suicide looks like on your campus, then you can use that information to identify priority pieces of the problem that you're going to address, and that would be developing your long-range goals for your suicide prevention efforts. So here's another quote from an alumni grantee, and this really sums up most of what I have to say about this particular step. Here you're thinking big, you're really focusing on the macro change, the change in public health on your campus around changes in suicidal thinking and behavior. But you also want to balance that with being realistic. So in terms of setting those goals, here are some helpful questions to think through the who, what, why, and when, if you will, for your goals. Basically, clearly identifying what it is that you hope will change. Are you looking to decrease suicide attempts on your campus, reduce suicidal thoughts? And also, I know many of you are focusing on specific populations, and that's a good thing because there are higher risk populations most likely on your campus. So who are you trying to influence, and for whom are you trying to reduce suicidal behaviors, and by how much? And then, of course, when do you expect that change to happen? And the big challenge, how will you measure it? But someone mentioned that some of your problem analysis can give you some baseline information where you can track change over time. So you're using your data to kind of focus in on the who, what, and when of where you can have the most significant impact, but you also want to balance that with what you can actually achieve. And so the information that's maybe more qualitative that you get from stakeholders and others about the campus climate, the context, the priorities of your campus community and the perceived needs in that community are going to feed into what you can really get done realistically. And it can also be helpful to look back at the different kinds of initiatives that have been successful on your campus in the past. And some of those successes might also tell you about the kind of change and timeframes that are realistic for your long-term goals. So now that we've done the big picture stuff, I'm going to hand it over to Sheila to talk more about what should be done once you've got those long-term goals in place.
That's good. Thanks, Ellie. So I'm going to start with step 3, which involves identifying key risk and protective factors that can help guide where you want to focus your efforts. Knowing about the risk and protective factors for suicide helps you hone in on the specific behaviors that you want your intervention to be targeting. Risk factors are characteristics that make it more likely that an individual will consider, attempt, or die by suicide. Risk factors indicate that someone is at heightened risk for suicide, but they don't necessarily mean immediate risk. Immediate risk factors are considered warning signs, and often these get confused. So it's important to understand the distinction between the two. And then protective factors are characteristics that make it less likely that an individual would consider, attempt, or die by suicide. So having an impact on these risk and protective factors will help you achieve your long-term goals, the things like decreasing suicide attempts or reducing suicidal thoughts. So these would all have an impact on the longer-term goal of decreasing suicide rates, which we know is very difficult to do, especially in a campus population where you may have a small number of actual suicide deaths in a year, semester, or a few years, but you might still have a fairly distressed student body. A lot of our suicide prevention work focuses on identifying individuals at risk, and it's still important to build upon the protective factors that have been identified, which are a key component of the comprehensive suicide prevention program. And to build upon the protective factors is essential in preventing individuals from getting to the point where they are considering suicide in the first place. So I wanted to highlight this resource that SPRC has, and you can find it under the Suicide Prevention Basics tab on our homepage, and it's related to the major risk and protective factors for suicide. So you'll likely see a lot of lists of risk and protective factors across the field and on different materials, but what this document aims to do is focus on the most common ones that we know about. It's important to keep in mind that some of the risk factors have a stronger evidence base about the relationship to suicide risk, while other ones may not have as strong of a link to suicide risk or may have less evidence that demonstrates the relationship. So there are some risk factors that are more stronger than other ones. And the risk and protective factors vary across populations, and some may be more relevant to certain populations that you're working with than some of the other ones. So we encourage you to use the ones in this document as a part of your program activities. And then moving on, this is a table that you'll find within the SBRC resource. It describes the risk and protective factors and warning signs for suicide and references the research that went into determining these factors. As you can see, the common risk factors include prior suicide attempt, mood disorders, substance abuse, and access to lethal means. A few of the common protective factors include connectedness, availability of physical and mental health care, and coping ability. And the warning signs include things like threatening to hurt or kill oneself, seeking a means to kill oneself, hopelessness, increasing alcohol or drug use, and dramatic mood changes. So knowing what these factors are helps you target your interventions further. For example, alcohol use is often an issue most college campuses have to deal with, and those of you who participate in the National College Health Assessment will already have access to some data that is collected about alcohol consumption on your campus. There may be an office or staff member responsible for alcohol prevention initiatives on campus, or administrators who are a part of discipline issues related to alcohol use. And both of these groups and people can be potential partners to work with. Seeing how you can collaborate together to decrease risky alcohol behavior could also prove to be a win-win situation for each of you. Additionally, students who are coming to campus with already diagnosed mood disorders or who have had a history of prior suicide attempts may warrant more proactive outreach as a part of your suicide prevention efforts. Moving on to step 4, this is a step where you will select or develop interventions based upon the goals you've decided upon. And there's several ways to do this and a lot of resources that can help you. SBRC has a best practices registry, which you can find on our website. There's also the National Registry for Evidence-Based Programs, or NREP. A lot of you have included programs in your proposals that you've heard about other campuses doing or that you've already done some research on. So it's important, just a few things to keep in mind when you are selecting interventions, that you want to try to select strategies that are evidence-based and that are grounded in a strong empirical or theoretical base. This is when you might want to look at what other campuses have done and how these strategies might fit in with your goals. It's important when you're taking a program created by another campus to consider the population and setting that the program was initially developed for, and what the barriers and benefits are to adapting this program to your campus. Just because it worked on another campus doesn't necessarily guarantee that it would work on yours. And since suicide prevention is unfortunately a fairly new field, there are often gaps in the available research. So what do you do if research is lacking or if there isn't an evidence-based program that meets your needs? At this point, it's helpful to turn to other relevant theories such as behavior change theories or health promotion theories to guide your decisions. And it can be helpful to look at best practices from other health promotion areas like alcohol prevention or violence prevention to get a sense for what has been successful in the past. As you consult the science, there are several questions to consider that can guide your process. For example, what strategies have been successful before? Would an established intervention need to be adapted for your setting? What if research is lacking? What if there hasn't been evaluation? What have been particular challenges for effective implementation? What are common mistakes that have been made in implementation? So there's a document from NREP that we linked to on a slide towards the end of this webinar that's called Questions to Ask as you explore the possible use of an intervention. And I encourage you to take a look at it. I personally have found the categories they list and questions they pose in it pretty helpful, and these will all be relevant to your planning and implementation process. So when you're working to select your strategies, you'll want to directly connect them to your identified goals. Creating a logic model can be very helpful in this process. I know some of you have logic models in your proposals and may have seen or worked with fairly complex logic models before. If this is a tool that you have more questions about developing or would like some assistance on, this is something you can talk to your prevention specialist about, and they can help you further with it. Logic models do not have to be super complicated, and the idea behind them is really pretty simple. So they're basically a tool that helps make sure you've thought through your program and that the inputs, activities, and outputs link to the long-term goals that you want to see. The resources you use and the things you do in your program need to logically make sense that they would lead to the outcomes you're hoping for. So to do this, you think through each step, step by step, why you expect your activities to lead to the change you want to see, or in other words, your outcomes. So just walking through one example, for instance, if you distribute information about the National Suicide Prevention Lifeline, how would that be linked to reducing suicidal behavior? So we assume that if you distribute information, some at-risk people or their friends will pick it up. We hope that if they pick it up, it's likely that they will read it. If they read it, perhaps they'll call the number when they're in crisis. And if they call the number, it's likely that they'll get help both on the phone and hopefully after from local services. And that's ultimately the process that leads to the change we're looking for to reduce suicide. So this is just an example of how walking through the logic can help you identify missing links or assumptions about the process that may need to be addressed. And we're going to come back to this with a few examples that we'll do together on our own. And before we do that, I do want to talk a little bit about SMART objectives. I think many of you have probably heard of these before, and we'll just walk through each component of the acronym a little bit. Once you've determined your long-range goals, the SMART framework can help you think more clearly about what you hope to achieve with your shorter-term goals and objectives. So first off, you want to make sure that your objective is specific. Your objectives should answer the who and what of your program activities, like Ellie mentioned earlier, and will determine what exactly your target audience will get out of your intervention. So the greater the specificity of your goals and objectives, the greater the measurability, which will help you evaluate your efforts. A few suggestions that we have when developing your objectives is to stick with only using one action verb per objective, because using multiple ones may imply that there's more than one activity or behavior that's being measured. And so to keep it simple and specific, you want to just stick with one action verb. And you want to try to avoid verbs that may have vague meanings to describe the intended outcomes, since it may prove difficult to measure them. So instead use verbs to document action. For example, instead of saying that something is going to increase understanding, you could say, at the end of this activity, the students will be able to list these 3 things. And those would be related to whatever knowledge or information that you want to make sure people are retaining once they leave. And then the greater the specificity, again, the greater the measurability, which will help your evaluation. So moving on to the M, the measurable piece, the focus here is on how much change is expected. Objectives should quantify the amount of change expected. It's impossible to determine whether your objectives have been met unless they can be measured. And they provide a reference point from which a change in the target population can be measured. So like Ada said in the chat, getting a baseline is a way to have something to measure off of to see if there's been a change or an improvement. Making sure that your objectives are measurable is key in getting clear for yourself when you're breaking down your activities in the logic model and thinking about the different steps that are involved. And knowing how you'll be able to measure your own success is an important part of generating support and advocating for your program overall. Moving to the next one, the A stands for achievable. Objectives should basically be attainable within the given time frame that you've set for yourself. And I know this seems pretty obvious, but I think sometimes it's easier said than done. We can sometimes set ourselves up for failure by making goals that are too ambitious for the time frame that we've been given. And then the R stands for realistic. Objectives are most useful when they accurately address the scope of the problem and programmatic steps that can be implemented within a specific time frame. So it's closely tied to it being achievable and basically related to what you feel you can accomplish during the life of your project. And lastly, the objectives should be time specific. So including a specific time frame will help you measure your objective and see if you've accomplished what you set out to do in that time period. And so just looking at a few examples, and we'd like to hear from all of you, again, in using the chat box. So just thinking about the SMART criteria that we talked about and looking at this objective. So for example, creating a brochure to increase awareness of mental health services available to students on campus. So I'm wondering if people think this is specific. Specific enough. And I guess I would say, there's a couple people typing. Nope. And how would you make it more specific? I see that multiple people are typing. So identify info regarding mental health services. So maybe being more specific about mental health services. Think about what goes into the brochure and what people will learn by reading it. Awareness is a big word. It's a really great point. And then be more specific about the content. So students as a target population is pretty broad. So maybe you want to specify a little bit deeper who the target population is. Great. How to access services and who should access them. Wonderful. Thanks, everyone. So yeah, there's definitely ways to make this a little bit more specific as to the who and what you want to see happening. In terms of whether it's measurable or not, there's definitely information missing about the number of brochures or being able to find out if students got mental health services, if they did so because they saw this brochure or not. So there's ways to make this a little bit more measurable as well. Do people think that this is something that could be achieved during the grant period? Time specific, yep, there's no time frame that's given for this objective. So you could make it more time specific by adding during the first year, or the first 2 years, just putting a time period on there. How will the brochures be distributed? Great questions. So going back to whether it's achievable or realistic, it seems like this could be a realistic objective throughout the grant period. And then if it's under being realistic, because it is addressing a problem, the objective could increase increasing help-seeking behavior if the students do get the mental health services that they need. Okay, so we're going to move on to one more example. So developing educational seminars around time management and conflict resolution for first-year students. So what do people think about making this a little bit of a smarter objective? And going through whether it's specific, whether you think it's measurable. I see lots of people are typing. That's great. Thanks so much for participating. The target audience seems specific, yep. So first-year students is sort of narrowing down the overall campus population. You need more specific information, so content in terms of learning objectives, target population, and time frames. So it could be more time specific. Will it be all first years? And then what is being measured exactly? So how would you measure this? How would you make it more measurable? it's specific, but you need more details on the number of seminars, the time frame, modalities, resource people, having a pre and post evaluation. You guys are great. These are all really great ideas. Getting baseline data and knowledge of these concepts in this population. Yeah, absolutely. So how do you know if there's been an improvement if you don't know where people are starting off with? Is it possible that this could be two goals, development versus implementing? That's a great point. So developing the educational seminars is one thing, but then implementing them could be another one. And then indicating how students will go to the seminars. What's the incentive to get them there? Great. All right, so we'll move on to going back to sort of the first example that we talked about. We know that having SMART objectives can only bring you so much success. And going back to mapping out your goals and what we talked about for the logic model and understanding what your assumptions are and being able to identify any gaps that there might be is another part of making sure that your objectives are making sense and that they're related to your long-term goals and the outcomes that you desire. So let's go through some examples of this with one of the examples we just discussed. If we create a brochure to increase awareness of mental health services for students, they will be more likely to seek help. That's sort of the assumption that we're making. So what are some of the missing links that you see here between providing brochures and people getting help? And what would need to happen between creating the brochure and this end goal of increasing help seeking? And feel free to go ahead and use the chat again. Where are they getting the brochure? Well, info will be there. Absolutely. So how do we know they'll, find the brochure, get access to it, and then how do we know that the information that's in there will influence them to get help? So students have to be moved from thinking about getting help to getting help. So that may mean dealing with stigma. So there might be other barriers involved in why somebody isn't getting help. It might be more complex than just having access to the information. What promotional activities will complement this? That's a really great point. So having a brochure in isolation might not help you achieve your goal if there's not other initiatives taking place. It's assuming that there's help that exists for people to access. Knowing what the barriers to seeking help are, doing a focus group with students to see what information needs to be included, and the best place to have the brochures so students can access them. Absolutely. And then contact information provided should enhance help-seeking behaviors and cross-check with the campus counseling center to monitor source of referrals. Great, thanks, Martha. We just talked about that yesterday, so it's a great point. So just a little bit, our logic behind this is that if we distribute the brochures, we are hoping that people will pick them up and read them, and we hope that they will gain some knowledge and follow through with that action of getting help for themselves or somebody else. We know there might be other factors that serve as barriers, as somebody mentioned stigma, and then having other activities in place to support the behavior as well. So the brochure alone might not be as effective as if there were other activities in place too. So we will go ahead and do another example. If we develop educational seminars around time management and conflict resolution for first-year students, they will be able to cope better. So what are some of the missing links or assumptions that we're making here between the seminars and this sort of goal of helping them to cope better? So Michael's saying it assumes that time management is the problem. First-year students face many problems that may not be accounted for by the seminar. Absolutely. So there would have to be some reason for why you would focus on this content. Why would you decide that time management is going to be the focus? There might be other issues affecting them as well. And that imparting information changes behavior. Great point. Thanks. So it might not necessarily be a lack of knowledge that's serving as the barrier. Great. I see lots of people are typing, so that's really great. Okay, so Martha said this could be incorporated into the university life courses for freshmen, which is a great point. So sometimes there's existing programs or existing avenues to reach people, and instead of duplicating efforts or duplicating the time that you're asking of students to attend another seminar or another event, seeing what existing things are happening and incorporating the content can be really helpful. So cope better is rather vague, what changes. So defining a little clearer what that behavior actually means can be helpful, and making your objectives a little more specific. So the goal is to change behavior or improve coping skills. Education doesn't ensure understanding and behavior change. Absolutely. Great, thank you so much. These are really great comments. So Denise asked me, has this been done before? What was the outcome at our campus or others? So seeing how it's worked on other campuses like we talked about, and would it work on yours? Or like Michael said, maybe the issues are different for the first-year students on your campus. And we will do one more example. If we train faculty as gatekeepers, at-risk students will get the help they need. So I think everyone's familiar with gatekeeper training, basically trainings that educate people about the risk factors and warning signs and becoming more comfortable with asking somebody if they're thinking of killing themselves. And so what are the missing links here and some of the assumptions? So the assumption is that students reach out to faculty. See that people are typing. Great. The gatekeeper training needs to be more comprehensive and involve res life and other people in key roles. And then provided the faculty who are trained have access or know who the at-risk students are. So some of the assumptions are that the faculty that you're training will come into contact with at-risk students, and that these students are going to be reaching out to faculty. What skills are included in the training? So again, the learning objectives or being more specific about the content. So we did gatekeeper training yesterday and learned how important it is to have a clear, simple referral plan for gatekeepers to follow. Involves the protocol as well. So a major part of gatekeeper training is giving people the information about where they should refer students when they do need help. Yep, and define help. Great point. So I think, Denise, what you might be getting at is looking beyond traditional mental health services. Are there other support services or other people on campus who students are seeking out when they need help or are distressed? And does it always need to be the counseling center? Great. Sounds good. So, sorry about that. So just wanted to go through a few of those examples, kind of just thinking about how you can make your objectives that you have already determined, or some of the activities that you're doing, and how you can make think about the long-term goals and make your objectives smarter, make sure that you're thinking through what some of the assumptions are and what some of the gaps are and how your activities are leading to your overall goals. And oftentimes there might be barriers or there might be gaps that you'll encounter that you can change or make improvements upon along the way. So the reason why we went through these examples is really just to show the importance of mapping out your goals and objectives so that you can identify strategies and interventions that will be most likely to bring about the outcomes that you're hoping for. I think with this last example, we often see campuses struggling to get faculty to their gatekeeper trainings, but if you map through your goals and the assumptions behind successfully executing these goals, this might not necessarily be the best use of program resources. So faculty may not be motivated, there might be other barriers, maybe there's other information that would be more useful to them than attending a gatekeeper training. And we're assuming that students will talk to faculty and that faculty will use the skills in the training. So these are just a few of the things that come up when you go through the process of mapping out your goals and objectives. So thanks to all of you so much for your participation. It's always fun to see people chatting in. And hopefully these exercises are helpful to you. And I'm going to go ahead and pass it back to Ellie.
Thanks, Sheila. And I want to just echo that. You guys have been great participators so far. So we're going to shift gears a little bit, but I wanted to just give everyone, how about 30 seconds, stand up, stretch. You're doing a great job. It's Friday afternoon, or maybe still slightly morning on the morning side for those on the West Coast, but you guys are really doing a great job towards the end of the week when I know brain power is lacking. So stretch, take a breath, and I'll give you another few seconds to sort of reorient yourself before we dive into sustainability. All right, well, so now that we have taken you through the details of some of the initial stages of strategic planning and thinking about your big picture changes, your SMART objectives, your logic models, it's time to look down the road a little bit. And again, 3 years probably sounds like a really long time right now, but trust me, it's going to go by really quickly. And for the goals that you have over the long term, they might actually take more than 3 years. So you want to be sure that what you're building with the grant right now can help suicide prevention on your campus continue even when funding ends. So last year, we talked to a number of alumni grantees who were successful in sustaining their suicide prevention efforts beyond the Garrett Lee Smith grant. And based on their responses, we developed these 5 key recommendations for sustaining suicide prevention programs. And we have a detailed report if you're interested in finding out more about some of the specifics of what we learned. But today, I just wanted to share with you in a little more detail each of the recommendations and some of what we heard from alumni grantees to sort of help frame how you can and how we recommend you should start thinking about each of these areas right from the start of your grant. So first, we recommend adopting a sustainability mindset. And by this, I mean that grantee leaders and project teams should keep in mind a vision of what you want to have in place when funding ends. And not just keeping it in mind here when we're asking you to think about your program design a bit and maybe tweaking some of the specifics of what you're doing, but even as you go through your grant project, you implement, you make tweaks and changes. Whenever you're making a decision or choosing a new path, always keeping that vision in mind of how what you're building is going to be able to continue throughout, beyond the grant. And for each of these, I've included a quote from some of the alumni that we talked to. I'm not going to read those out loud, but do take a look. And again, we'll have the link to the report toward the end of the presentation in case you're interested in finding out more. Second, we recommend catalyzing momentum for suicide prevention efforts in your setting and community, in your case, in your campus, and even the surrounding community. And it may be that you already have a strong local impetus for suicide prevention on your campus. Maybe that's why you were able to put together your proposal. And in that case, you want to sustain and nurture that momentum throughout your project. In other cases, your campus community may be at a lower level of readiness, and in that case, you'll want to work to build this momentum throughout the grant. And you can do this by engaging the stakeholders and influencers that you're probably already reaching out to for program implementation. You want to engage different community groups to build strong support for suicide prevention across the community, both on campus and off campus, so that by the end of the grant, people can't imagine life on campus without these programs. And they demand that they continue. And in our interviews with grantees who had finished their grants, this broad community support and buy-in were really critical when the programs were at the end of their grant and looking for additional resources or partners to continue those suicide prevention activities. So some ways that those alumni did this were by using data to make the case for suicide prevention, meeting one-on-one with potential stakeholders and opinion leaders, bringing together new stakeholders and very diverse stakeholders to create a task force or coalition. I'm sure many of you are thinking about that or maybe already have something like that in mind. And as Sheila mentioned when she was talking about alcohol on campus, sort of dovetailing with folks that share a goal of preventing other negative outcomes that are connected to suicide. So drawing on their momentum can also help you build that community support. Third, we recommend fostering strong leadership. And of course, many of you are the leader of your grant program, so maybe this has to do with looking a bit at yourself, but I also recommend if you do have even a small team of folks working on your grant to think about sharing the leadership and building a team that has some of these skills that we found in interviews with alumni grantees to be critical to set the stage for sustaining the program after grant funding ended. So the people we were talking to in our interviews were also the leaders of their projects, so they didn't really list all the skills that they had, but we noticed in talking with them that there were skills that they had that really had helped their program survive and thrive. And those are things like project management skills, development and grant writing skills, communications, community organizing, strategic planning, coalition building. So kind of thinking through how you yourself can strengthen your skills as a project leader, or maybe how your project team can sort of bring those different elements together. That's going to be really important in laying that groundwork for sustainability. Fourth, we recommend cultivating partnerships and nurturing those relationships so that your partners become joint stakeholders with a vested interest in the success of suicide prevention efforts. when we talked to alumni grantees, partners were really essential. And I know all of you are already partnering with a number of folks. You really need partnerships to be able to implement a Garrett Lee Smith grant. But these partnerships were equally important in sustaining programs after funding ended. And there were a variety of roles that partners played for the folks that we talked to. Some partners helped to build that trust and buy-in throughout the community. Some helped to raise awareness of program successes and the importance of the suicide prevention effort. Some generated external support through in-kind services and materials that they provided. And some helped sort of build infrastructure beyond the original scope of the project. One thing that alumni grantees told us was that as they were getting toward that point where they were thinking about sustainability, where the grant was ending, that they found that sometimes they needed different partners to sustain the work than they had needed to implement the Garrett Lee Smith project. So we encourage you to keep thinking about your diverse list of partners, thinking about new, maybe non-traditional folks you can involve both on campus and on off-campus that maybe you wouldn't initially think of for suicide prevention, maybe local businesses, for instance, or faith leaders. And then also to give those partners a clear purpose or vision and be sure that you have that for any task force or coalition that you're convening as well. And finally, we recommend planning how to secure additional resources to sustain your suicide prevention efforts. And of course, everybody thinks of funding when you think about sustainability, so I just kind of want to put that out there as is it the elephant in the room? But actually, the people we talked to most commonly had gotten their different partners to contribute resources to the effort. So sometimes that was monetary, but sometimes that was taking on certain functions that had previously been part of the grant program. Sometimes partners were able to integrate grant activities into their larger organizations. So for instance, the department in charge of training new staff, incorporating suicide prevention training in their orientation program. So then it becomes part of their budget, part of their responsibility, and it no longer needs to be a responsibility of the suicide prevention program officially. And then many folks did obtain some additional funding, but an interesting thing that came out of the interviews was that many programs didn't need the same level of funding. Basically, they had built something that was very strong, and so maintaining that didn't take as many resources. So definitely worth planning on how to secure additional resources, looking for opportunities as you continue to implement your grant, and thinking creatively about what additional resources really means. So we're going to move to a slightly different format, and that's sort of what I had on sustainability, and I was very curious to find out from you whether you've been considering any of these areas. Maybe you already planned, really thought about sustainability as you were designing your project, or maybe some of these items made you think about a way that you can sort of build in sustainability in a specific way for your program. So I'm just really curious to hear from you in the chat box how you're thinking about sustainability at this point. And I know, again, it seems a long way off, but you sound like a pretty strategic bunch, so I bet you have some ideas. I see a few folks are typing. And of course, I want to acknowledge in the proposal you had to say something about this, but it might seem a little bit different now that you're actually starting to implement your program. I see a bunch of folks have something to share. all the suspense. There we are. Oh, great. So Martha's looking at a three-pronged approach, looking at stakeholders in terms of students, decision makers, and community partnerships. Excellent. Okay, so Naomi is sort of building some infrastructure there, developing a credit-bearing course for folks to become peer health educators. Wonderful. Having QPR trainers become master trainers. That's interesting too. One thing that we did learn from the folks we talked to in our interviews is that that there does need to be some more thinking to the train-the-trainer approach. We talked to some folks, for instance, who trained many gatekeeper trainers, but then without a focal point to help organize the specific trainings and the venues and advertise to get people to come. Many of those trainers actually didn't continue. So I think that's interesting that you're thinking of the master trainer idea, and I'm wondering how that will affect how that lasts. Let's see. Yes, so Selena is talking about keeping the university engaged and making sure they see what the benefit of the program is. I think that's a wonderful strategy, and it's great to think about from their perspective, what benefit are you bringing to the campus? So suicide prevention obviously is important, but there may be other benefits to your program. Active Minds chapter, great. Consulting to assist us to become stronger in the social media field and to teach us how to do better at raising awareness. Great. So you're building your own skills to develop a deeper capacity for communication that hopefully you can continue to implement afterwards. Great. So those are some good ideas. And certainly there are many other strategies and specific examples in the full report. I'm wondering at this point, since we have a few more minutes, if there are any other questions that people have or thoughts that came to your mind, whether about sustainability or maybe some of the previous discussion around strategic planning, or if there's anything you want to share about your experience planning your grant or planning for sustainability. Martha, you're a very consistent participant. Thank you. As Martha types and maybe the rest of you think about all of the content that we've thrown at you today, I do want to also emphasize that your prevention specialist is always available to talk through, any questions you had about any of the content we covered or any new ideas you have about how you want to maybe tweak your program or think about sustainability or clarify your objectives. So we're really here for that kind of brainstorming or just to bounce ideas off of. So please do take advantage of that. So I'll leave a little more time for any questions that people have. And you guys have all done a great job of participating today, so I do appreciate it. I don't see anyone typing. Oh, sorry. Share about forming the committees. Oh, sorry. Martha, could you remind me more specifically what you're referring to? Sorry. it might be you're referring to task forces or advisory boards, committees with campus administrators. Many of you may be thinking about forming a task force or an advisory board to advise your to advise on the grant implementation, and I actually think that's a great idea because that way you can sort of formalize some of the key stakeholders that you want to have involved and get some feedback from them on the direction your project's going in. So I'm not sure exactly what I can share here, except that people felt that it was really important to provide those groups with a clear scope and role. And we have a lot of information and resources and examples of how other folks have defined that for their task forces or advisory boards. So that's definitely something your PS could help you with. The other point from the sustainability interviews had to do, I think, with picking very strategically who you involve. So, so Martha talked about campus administrators, and there are certainly other folks both on and off campus who might be key, maybe the head of campus police or the local mental health clinic or center. So I see that Sheila will follow up with Martha, but I do think it's worth taking some time to think about who beyond maybe the traditional folks that you've worked with in the past on student mental health issues, if you've done work like this in the past, maybe expanding that circle. And of course the challenge then is to keep it to a manageable sized group. So there may be other venues where you can draw in other stakeholders as well. So I'm going to go ahead and ask for one final time if there are any other questions. And thanks, Martha, for that question. Sorry, it took me a moment to wrap my head around it. Any other questions or comments that people want to add? And I don't see anyone typing, so I think I'm going to go ahead and wrap us up and let everyone leave a little early on this Friday. So again, we're going to archive the webinar on the grantee pages of our website, and any staff or colleagues that are working with you on the grant who couldn't come today can view the whole recording there. And we also have a resource slide here with the links to some of the resources that we talked about, as well as some other materials that will be helpful around specific aspects of strategic planning. And the first resource listed here is actually the report from those sustainability interviews that we did. So you can get a lot more detail there on what those experiences were of the alumni grantees we talked to.
Ellie, I'm just going to jump in here too. When I close the webinar, for most of you, that web page will actually pop up automatically on your computer screen. Thanks.
Thanks, Phil. And we want to thank all of you for joining us today and for your excellent participation. It sounds like a lot of you are already thinking very strategically and thinking about sustainability, so we really appreciate everyone sharing your ideas and plans. And we hope, as I said before, that you'll talk some more with your prevention specialists about any questions or thoughts that today's webinar inspired. And thanks again for joining us. We hope you have a wonderful weekend.